So, we've declared a state of emergency. So we have the EOC, Emergency Operations Center, meeting twice a week. And we discuss the next things we're going to follow up with throughout the week and things we're going to check on. So one of the things was trying to find people to deliver groceries. So I contacted our churches work together in North Dumfries. So they were, and it's called the Ministerial, and it's all the churches coming together to do events together and work together. So I contacted the Ministerial and asked if they could find volunteers for delivering the groceries, and they've stepped up amazingly. See, what you do is when something like this happens, a lot of people that are really active and energetic, all of a sudden have to be still. Now, I've always said if you wanted to punish a person that's a doer, don't let them do. So they are really interested in volunteering and helping out. And this is true at the regional level. The region, I sit on the pandemic committee at the region, and they have the volunteer action committee, and people are volunteering, but nobody's calling up and saying they need the volunteers. So if you know of businesses out there or volunteer groups, not volunteer groups, but not-for-profit organizations that need help, if they could reach out to the Volunteer Action Committee, this Volunteer Action Center can connect the volunteers to them. So that's one of the things we've started to work on. We're working on trying to get people to reach out through their phone or Skype or Zoom or whatever and talk to each other. Share a laugh or share a joke, or talk about how things aren't going quite the way you wanted them to go or expected them to go. The strain's starting to take hold. And then on top of that strain, there's the conversation about the masks. Masks sound like a great idea, and they really are, except for will people become complacent? Will they think the mask is the safety they need and take further risk? And if they do, instead of blanketing the curve, we will escalate up the curve, and that's not what we want to happen. So I'm for the mask, but I'm also for people realizing it is not the way to solve or resolve this situation. It is just one extra tool in the toolkit. We get to set out certain rules and regulations within the township. Our bylaw becomes legal, they can enforce them. And we also call upon resources. So everyone is working on how to get through this pandemic. Well, basically we're following along with the other municipalities, the 7 municipalities. So it's a social distancing, it's the closure of our parks, it is preventing gatherings. And so our bylaw goes around and makes sure everybody's doing what they're supposed to do. And they have the ability to ticket. So I'm trying to get a virtual men's breakfast, a seniors coffee hour, trying to figure out how to do bingo where people could make up their own cards and anybody in the group would take their turns doing the numbers, things like that, getting games and getting interactions. We talk a lot about children, and we talk a lot about seniors and moms, not as much about males, because the men make it less known, but I think they feel the strain just as much because they want to be doing. And haven't heard a lot about teens, how teens are managing. If you get a chance, I'd like you to maybe look at that graph showing the impact by age group, because it's quite shocking, because actually people over 60 are now among the smallest. And it's hitting I believe the teens up to the 59-year-olds, the most. And that's exactly the opposite of what we thought would happen. Now, maybe the incline will happen with all the deaths within the nursing homes. And that's quite sad. I wonder if we should actually step in at some point. The government would have to step in and say, no more wards. See, most nursing homes have 4 people to a room or 2 people to a room. And maybe we need to get away from that. I'm not sure how we do it, and people are wondering how we would staff it. But again, there's a lot of those volunteers out there. So maybe that's the thing we should be looking at to next. I think people have the misconception that we're doing okay. As I said in another online video, we're at war. This is a world war, and our fight is against a pandemic. Never before has our world been in this situation. We've had to self-isolate and to draw back from our society. And we have to do that now. And we're just at the peak. And how people react in the next 2 weeks will either decide that it'll be upward bound or whether we will start to blanket the curve. So they have to understand the next 2 weeks are critical, and possibly even the next 3 weeks. So please, please hold on to those restrictions. Remember social distancing, wash your hands, isolate. The masks are wonderful, but they will not save us. What will save us is keeping to the rules and following the regulations. Try and be patient. Understand this is 3 weeks in a lifetime. It's not your whole life. So let's do this so that we can all survive it together.